Welcome to the Learnskin podcast with Dr. Raja and Dr. Hadar, where they discuss all things skin. Skin is fascinating because it affects us in so many ways, like our health, psychology, and how we connect with those around us. This podcast delves into the art and science of skincare. A short disclaimer before we get to the good stuff. Dr. Raja Sivamani and Dr. Hadar Levtov are board-certified dermatologists. This podcast is meant for educational and informational purposes only. All opinions shared do not express the views of Learnskin. Neither this podcast nor any information contained within it are a substitute for professional care by a doctor or other qualified medical professional. This podcast does not constitute medical or other professional advice or services.
Hey Raja, how are you today?
Hey Hadar, how are things?
Things are going pretty good. I think we have another podcast today, and I am very, very excited about our guest today because when people ask me about alternative approaches to medicine in general, Chinese medicine is one that I think of, one of the first ones that comes to mind. And when I think of Chinese medicine dermatology, I don't think anybody thinks of anybody else but our guest today. Would you like to introduce our mystery guest?
Oh, our mystery guest is quite well known. It's Mazin Al Khafaji. He's master herbalist, and he has been studying Chinese medicine probably in the most authentic way of anyone I've ever met. So Mazin is not only is he a master herbalist and traditional Chinese medicine practitioner, he also talks a lot about quality and quality control on how the treatments are made. And he has his own dispensary called the Avicenna dispensary. I've been there. It is such a workshop of how they've put together this whole process. And he has his own herbs, and he has full quality control. I think not only about just making orals and whatnot, he's also got a way of making an effective range of skin creams and ointments. And so we truly are in for a treat today because it's from beginning to end, master diagnostician. He's got a great photograph room and the ability to control how he's going to be delivering each of the treatments that he's going to be doing. Mazin, welcome, and we're so excited to be talking to you today on the podcast.
Welcome.
Raja, Hadar, thank you very much. That's an awesome introduction. It's a great pleasure for me to be here. Thank you.
Absolutely. And I think, not to give away your age, but Mazin has been practicing and actually publishing since the last century. And the reason I mentioned this is because he has been witnessing firsthand how the approach to Chinese medicine and dermatology has evolved over the years. So I would like to start our discussion, maybe, Mazin, by you telling us, why should our listeners care about Chinese medicine in the 21st century? Isn't this some ancient thing that somebody found in a scroll a while back?
Well, it certainly is ancient. I mean, its history goes back to the very dawn of time, really, with bone oracle carvings of names of diseases, especially actually skin disease. But what's so interesting about Chinese medicine is over the centuries, it's evolved, it's gathered information empirically, and really just developed into what we see today, which I'm certainly a great fan because I use it and I see its power. In China, there are literally thousands of hospitals where traditional Chinese medicine is practiced. And the Chinese are very practical people. They won't use something like this unless it had its part to play. They're also very excited and use Western medicine, but they haven't abandoned their traditional methods of treating particularly chronic disease. And I think that's where Chinese medicine comes into its own. It's the managing and treating of these persistent, recalcitrant, chronic diseases that we see so much of in this day and age.
Mazin, just to give everyone a little bit of a background, I think a lot of people get piqued when they start hearing about traditional Chinese medicine, how ancient it is. Can you give us just a small overview on what are the principles, just in broad terms, of how you approach the notion of health, the notion of imbalance, not being at harmony? What is the central tenet of the approach, and what is the way that you approach looking at treatments?
I think what's really interesting about Chinese medicine or Chinese science, really, and it is a science, is their understanding that the body-mind system is a complete, dynamic, fluctuating system that's constantly adjusting itself relative to the external environment, to maintain that equilibrium that we think of as health. So their approach to understanding how the body works and what happens when it doesn't work correctly is really based in that understanding. So they start with the premise that we are part of nature. And like any ecosystem that we see around us, we are highly sophisticated. And really the approach to treatment of disease is not just to attack the pathogen or the disease process, but to encourage a restoration of harmony and balance to this living organism that is so incredible, of course, this sentient beings that we are.
Thank you. That's such a great way to introduce the concept. I like the way you mentioned the concept of maintaining health. That's probably the very definition of integrative medicine and dermatology specifically. There's such a wide array of topics we can talk to you about. And I think today we wanted to maybe focus on some part focus ourselves around skin infections. And I think the first thing I wanted to talk to you about is the concept of skin infection and atopic dermatitis. I think there's clear notion, at least in the Western side of things, that Staph aureus, maybe some other bacteria, play a role not only in complicating the disease, but also in propagating the condition. And I'm wondering, how do you approach these cases overall when you see, because I know that you treat people with atopic dermatitis daily, and how do you approach this treatment for prevention, especially employing Chinese medicine principles that talk about maintenance of health?
Yeah, I think a really good way to introduce that is just to speak very briefly about how Chinese medicine tackles bacterial infection, or we can say also bacterial colonization. So if I may just present an overview of this.
Absolutely, go for it.
So we say that when treating what we today will call bacterial infection, Chinese medicine has three basic protocols for approaching it. The first is really to treat what we call, or to use a method that's called the dissipating method. And that is really equivalent to using primarily antibacterial ingredients to overact on bacteria and kill them off. So similar to antibiotics, but not as powerful as antibiotics, but actually very sufficient in many instances. So we'd use it for treatment of one-off infections such as impetigo or furuncles, mastitis, and such like. So in this instance, topical or as well internal medicine, if the disease is more rampant, are used to control the bacteria and kill it off and allow really the body's immune system to reestablish a stable state subsequently. So usually no follow-up treatment is required. That's what we call the dissipating method. The harmonizing method, which is really most relevant for what you're talking about, is used for more complex and typically chronic diseases where bacterial infections or colonizations form part of that picture in an otherwise relatively intact immune system. So here we use complex formulae to not only deal with the colonization of the bacteria as we see it. So in Chinese medicine, we have our own metaphors or language to describe that. Of course, they didn't have this concept of bacteria, but they certainly understood the concept that the body could be attacked by an exterior pathogen that then resides in the body. So complex formulae are used to not only resolve that, what we might call a toxic heat or a damp heat pathogen, in other words, treating the bacteria depending on how it manifests, but most crucially, to restore function to the body once you've achieved that. So just by using strong, what we'd call antibacterial or antibiotic medicines in this day and age would be considered insufficient to restore that harmony that the body is lost, which really would have allowed the colonization to take place. I don't know whether I made myself clear there, but...
Perfectly clear, actually, quite eloquently, as usual.
Thank you. So that's the harmonizing method, and I can easily speak more about that. But the third and final protocol that we use for bacterial infections is what we call the supporting method. And that sort of segues into the harmonizing method as well. And it's used in similar fashion. So basically, not only tackling the bacterial infection, but encouraging a normality to emerge in the immune system. But in this instance, the focus is put rather on a weakened immune state. And we use medicinals that are supporting or what we call tonifying ingredients that actually stimulate the immune system to work better in order to be able to overcome the bacterial infection. So typically we might use that method for cases such as MRSA, MRSA type situations in elderly patients or patients with ulcers, let's say, where the basic foundation of their vitality is insufficient to dispose of this pathogen.
What I think is really interesting about what you're talking about, it speaks to concepts that we are now utilizing in, I think, the Western approach. I mean, antibiotics, of course, is to reduce infections that are overt. Now with the colonization, as you mentioned, especially for atopic dermatitis, this really raises this conversation about the microbiome, because we know that the local microbiome tends to be, as we'd say, dysbiotic with an overgrowth of Staph aureus. And of course, the colonization there is out of balance. And then I can't think of any better word than to say a harmonizing method is exactly what you're trying to do in that scenario. You're trying to harmonize the bacteria before it gets out of hand. That's very interesting. And I think stimulating the immune system, we all know that there are infections, let alone bacteria, but even other infections, of course, that sometimes require the immune system to be stimulated. So I think it's very interesting that these concepts were there for millennia and that they've been used in treatment approaches. So it's very interesting.
Yeah, no, totally the case. And actually, I draw parallels with what we see around us. And we see the kind of problems that we're now facing in the world. A lot of them arise from really lack of appreciation of the interplay between the environment around us and our own environment. So obviously, we're part of the nature and part of the environment. We can't remove ourselves from this. So in the same way that in order to really tackle climate change or the way forests grow or don't grow, then we need to take into account all aspects. And I think any system that starts with that premise, the understanding that we're part of the integrated whole, it's a good place to start, that's for sure.
So perhaps you could give us some examples of how you utilize this in practice. I mean, I know that we've had other podcasts about Chinese medicine, and I think at this point our listeners understand that every case is different. But by and large, how do you approach a specific case of superficial infection, let's say in a kid or adult with atopic dermatitis?
Okay, so that's a problem I see a lot of in my practice. And I should also say, actually, at this point, in case I don't have a chance to say it, other conditions where antibiotics are often used in modern medicine, such as treatment of acne or rosacea or chronic folliculitis, this type of problem, also we use this method. So really what we're doing is understanding from perspective of Chinese medicine, what is going on with the body. So we have our own metaphors to describe real clinical events. They may sound odd to the modern ear, but I assure you, they're very much part and parcel of the reality of what we see in practice. So not unreasonably, ancient doctors borrowed metaphors from nature to describe these events. So we might speak about heat or dampness or toxin and so on. So we use the first port of call when faced with a patient with atopic eczema who has, let's say, a recurring infection. It may be really overt, so there is, weeping, crusting, patches of clear Staphylococcus aureus, golden bacteria, crusts, or it may be more subtle. So the patient may be prone to get some folliculitis or really persistent eczema that just is not controlled properly with the usual methods. So we make an assessment of that, and as I say, we use these metaphors that we understand fully and prescribe a formula of medicines to really to counteract that pattern. So let's say a patient has what we might consider toxic heat alongside what we call blood heat with wind. So these are metaphors that will make complete sense to somebody who's versed in Chinese medicine. But so we'll formulate a prescription that directly tackles that. And Chinese medicine really it's a matter of understanding these ingredients and how they combine in order to resolve that kind of pattern. So let's say in this patient who's had this low-grade infection, by prescribing that kind of medicine, the toxic heat is removed. So we see a clear improvement, let's say there's no more infection or there's folliculitis is cleared, well, then the treatment is not over by any means. We then need to move to the next step, which is to restore that harmony and equilibrium that I was speaking of earlier, in order that the body is able to maintain that stability. So we understand that in a situation where illness takes over, then the body is unable to claw its way back to a stable state. So the doctor's task is not only to rid the patient of this toxic heat as we see it, but to restore normal function in order that the system can maintain that once you've taken away the buttresses or the help that is achieved that.
Mazin, thanks for taking us through that. I think one of the things that's incredible about thinking about these conditions, because the ones that you mentioned when you talk about acne or rosacea, or when we say low-grade infection, we can just call that, over-colonization that's getting way out of balance for atopic dermatitis. Yes, we do use antibiotics, but I think we all realize within dermatology and recurrent folliculitis that obviously has just low-grade over-colonization that then can prolong to become folliculitis that keeps coming back over and over again. Like you mentioned, these are chronic conditions where the antibiotics serve a purpose to be perhaps more of an anti-inflammatory, or at least just to get a colonization back under control. And it's been a challenge, I think, amongst our field. I think many of us would agree that the challenge is that we want to try to reduce antibiotics for those situations where there's a clear-cut, overt infection that is getting out of control, and using the antibiotics in that kind of a scenario. But we really do struggle when it's being used for this chronic anti-inflammatory reasons, or for lack of a better term, to try to harmonize the body before it gets out of control. I mean, we have our approaches. So I think listening to you talk about this is incredibly important, because it shows that there are other options to try to keep that anti-inflammatory stance for these conditions without necessarily using up antibiotics, which are so important that we use them up appropriately so we don't start getting drug-resistant bacteria and whatnot.
Yeah, completely the case. I mean, antibiotic resistance, as you know, is one of the biggest threats really to global health and more, and food security and development, and really urgently new approaches to the use of this wonderful medicine. I mean, antibiotics are incredible medicine, but they need to be used appropriately. And particularly if there are other options where actually you can nudge the body back into a stable state, which is, of course, very accessible. I mean, we take for granted how well the body maintains health, but it's a miracle a minute that this is the case. So really, with a bit of help,
it's true.
We can really avert the need. I'm convinced of this because I do this day in, day out, and have, as you say, done it for 30 odd years. I'm convinced that Chinese medicine has a part to play in reducing this burden that excessive antibiotic use has led to.
I agree. And a few things that come to mind when I heard you speak. One thing was about the idea that not only when you see an overt infection on a topic, but you see flare. I think when you see a flare and you're not sure what's going on, at least one of my teachers always say, think of staph. That's probably driving this. We also try to target that, and I think it's very interesting that these observations have been made for millennia. One of the things that I wanted to ask you, because this comes up in my conversations with other practitioners about Chinese medicine, and I wanted to take advantage of your perspective because I know you worked through the years a lot, the Western dermatologist, is the issue of safety. Sometimes that's brought up as an issue with Chinese medicine. And I know that you, from our conversations and from listening to your talks before, I know that you go to a great extent to ensure your patient's safety. Can you speak to that? Because I think it's important for people to feel comfortable working with Chinese medicine practitioner in collaboration to know that their patients are safe.
Yeah, totally. Obviously, above all, patient has to be safe. I got involved when I came back from China 30 odd years ago with some dermatologists who were way ahead of their time, I would say, and ran some clinical trials on the treatment of atopic eczema using Chinese medicine, because they'd noticed that patients of theirs had shown remarkable improvement using this method of treatment. And of course, it was standard policy then to do a liver and kidney function tests alongside the trials that they ran. Incidentally, the trials showed spectacular improvement in the patients that they took on, and they were all severe cases. But at that stage, there was also this question mark about safety of Chinese medicine, which of course is always paramount. So from that time onwards, I have tested all my patients in-house, run liver and kidney function tests on all of them. And I'd say by now I must have close to 10,000 cases in my database. And I can tell you that it's extremely rare to get any elevation which is problematic of liver enzymes, let's say. Kidney, I've never seen any problems at all. Liver enzymes sometimes can fluctuate and go upwards, but it's extremely uncommon to see anything going beyond slight elevations, as I say. And quite often they return to normal of their own account. If they continue to rise and there's a problem, and sometimes that can happen, then obviously we withdraw the medicine, and that's the end of that. That type of medicine may not be appropriate. So those would be idiosyncratic responses. But by now, even though I continue to test all my patients, I feel that it's really using the belt and braces method, as we say, and really being extra cautious, and also just to continue to collect data. But I'm convinced that Chinese medicine, in the grand scheme of things, is a very safe form of treatment.
Yes, and thank you for mentioning testing and continuing your database, because I think your approach is so inspiring to other practitioners that really have a need for real data to support decisions. And I think you've been a champion of that. And I think we all are grateful for you for doing that. And you mentioned your practice, and I think in the introduction we didn't mention one very important thing is that you are really a renowned teacher and teach others how to practice Chinese medicine in an appropriate way, because there is that tendency sometimes trying to take Chinese medicine and put it into a capsule and sell it. And I think from our conversations, from conversations I've had with other Chinese medicine practitioners, that is probably not the way to do this. So I think I wanted to ask you, when you are getting other doctors come to your clinic, where you do your famous fellowship, what do you notice about how they change over time in their thinking, because they probably come from understanding of some Western medicine, and how they think about chronic disease when they go through your fellowship?
It's a whole range of things, actually. I teach a lot in Germany and Austria and Switzerland, where the majority of my students are actually conventional doctors. Many of them are dermatologists or immunologists. There's a lot of interest in those countries in the role of the Chinese medicine can play in treatment of chronic disease. Whereas in Britain or in the US, most of my students actually are practitioners of Chinese medicine. So most of them would have had to have gone through a 4-year program and get a degree in Chinese medicine. So it's quite varied, really. The approaches or the expectations of people can be quite varied. Having said that, the German and Austrian doctors are also usually very well versed in Chinese medicine. What I teach is really immunology and dermatology, which I'll include also allergy there, because these are all conditions that I see a lot of. So really, I present more detail in those areas to my students. And I see over a period of time, because my approach to teaching is very practical and clinical-based understanding of how they should use Chinese medicine, which is a seriously sophisticated system, which uses a vast range of ingredients in combinations in order to achieve changes in the body. So it's not an easy thing to get your head around, and it takes many years to develop that knowledge base. But I think we increasingly getting that type of standard. So Chinese medicine really is in its infancy in the West, but in the past 20, 30 years, it's moved on a lot. With that in mind, I've, in the past year or so, have finally collected together some like-minded people and people with good experience and good training. Many of them have done so for decades, and set up this international traditional Chinese medicine dermatology association to try and really set a standard and encourage sort of a code of ethic, continual educational development, training, and professionalism in our world, which is still needs that in order to really establish and get the very best out of what Chinese medicine can do.
Mazin, we in Ayurveda, we joke about not using scrolls anymore and moving to the 21st century with a website. And I'm assuming that the ITC-MDA has a website as well. Is that correct?
That's correct, yes.
You know what we'll do, actually? We can put it into the description when we put this podcast out there. We'll put it in the description so that if people want to learn more about the association, which I think, by the way, is a very important movement. And I'm thrilled to see that you're really thinking about this, the Code of Ethics, and actually getting a group of like-minded people. That's wonderful. There's a groundswell there. So we'll make sure that we can include that.
Thank you. Yes, it's very exciting because also it's an international community. So I have many of the European doctors, and many of them are conventional doctors, as well as the North American group. So it is definitely an international organization, and we have a lot of people with good experience who are really pushing that forward. So the idea really is to have a standard and get people to belong to the association and maintain their skill set with time. And hopefully we can demonstrate more clearly with clinical trials and such like the efficacy of Chinese medicine is going forward.
Well, that is an unbelievably important cause. So thank you for championing that and giving us a hint for your teaching abilities, because I know that you're coming to San Diego to the Integrative Dermatology Symposium to speak in more detail about various topics in dermatology. And so I'm eager to hear more, and I think all our listeners are probably eager to hear more. So we're looking forward to your talk and other workshop that I think you're running there. That will be at the Integrative Dermatology Symposium this coming October in San Diego. So with that, I think I want to thank you. This has been such a great, stimulating discussion. We went through the principle of Chinese medicine, talk about infection, went to teaching and championing safety and research and data in Chinese medicine. I mean, I think we covered so much in such little time, and there's so much more to cover. So thank you very much.
Hadar, Raja, thank you very much for giving me this platform. It's really wonderful. I very much look forward to coming to San Diego in October.
Thank you.
Thank you for tuning into the Learnskin podcast with Dr. Raja and Dr. Hadar. We would like to take this moment to tell you about our upcoming second annual Integrative Dermatology Symposium to be held at the Coronado Island Marriott in San Diego, California. This program is an educational experience jam-packed with information, including case-based discussions and multiple perspectives on topics such as psoriasis, atopic dermatitis, diet and skin microbiome, cannabinoids, hair loss, traditional Chinese medicine, and much, much more. Go to www.integrativedermatologysymposium.com and register today. We look forward to seeing you there.